Dr. Jack Schim has been board certified in neurology since 1988. He is the co-director of the Headache Center of Southern California and has 15 years' experience in the field of headache management. Dr. Schim notes the reasons why he's excited about injectable subcutaneous sumatriptan.
Subcutaneous sumatriptan has been available for a number of years and has been the gold standard in terms of acute rapid treatment for the abortive therapy of migraine. The great advantages of injectable sumatriptan are very high bioavailability compared to the oral version, and that translates into a much greater degree of success in terms of making patients what they want, which is pain-free. What we have seen clinically is often very dramatic. We see people come into the clinic, or occasionally we'll see someone in the emergency department who has an acute severe migraine, nausea, vomiting, their oral medicines haven't been working, whatever the story is, and to give them an injection and see them normalize in 15 to 30 minutes to the point that they say, "Can I go back to work?" is truly amazing. I think the place that this fits in is that because of the very high degree of absorption and the rapid kick-in, that even if a headache has been very rapid onset, where the usual instructions of treating at the earliest stage to allow the headache to be controlled before there's sensitization and before there's allodynia, then we see people get very good results. In addition, a significant number of people have their headaches come on when they're asleep, or they awaken with an established headache, so that they've already missed the early phase where an oral medicine might have a chance to work, and we've seen excellent results in that context. And then if someone has gastric peristalsis problems, in other words, queasiness or nausea or certainly vomiting, their ability to absorb an oral medicine has been very limited. And, of course, if someone's vomiting, the tablet may come right back up. Injectable works regardless of the context in that sense. I see Sumavel as an essential part of a patient's toolkit, not necessarily for every patient, but I'll tell you that probably about a third or so of my migraine patients have, from my point of view, a clear-cut role for Sumavel.
What do his patients say they want from a migraine drug?
Patients request successful treatment, pain relief that they can count on, quick relief, reliability, and thorough pain relief. Allodynia is the experience of something that is normally not painful becoming painful. In other words, touch becomes pain. And it reflects a change in the nervous system state in what's called sensitization. An example that most of us have experienced is if we get a sunburn, then even shower water can be painful. And in people who have migraine, once their headache gets to the point that touching their scalp becomes painful, then it starts throbbing and is painful, then oral triptans have a much lower degree of success. Injectable sumatriptan, Sumavel Dose Pro, can still work effectively despite that aspect of migraine.
Dr. Schim talks about some of the slower-working triptans, like frovatriptan and naratriptan.
They are reaching their maximum blood levels in an hour and a half, 2 hours. Pain relief is typically measured at 4 hours. Success in terms of achieving pain relief is in the 50% range, and success in terms of pain-free is in the 15 or 20% range. At the other end, we've got the injectable sumatriptan, where successful blood levels, peak blood levels, are achieved at 11 or 12 minutes. We see very high response rates, so much so that the same molecule, oral sumatriptan, compared to injectable, almost acts like a different product, a different medication, if you look at the success rate in terms of rapid onset relief, relief of people who have an already established severe migraine, which kind of pertains to the same thing of rapid onset. In other words, if someone has an onset of headache that's rapid but it's still very mild, that's not really what we're talking about. We're talking about headaches that come on and are fierce pretty close to from the beginning, just as if someone awakens and their headache is already bad. And then the nasal spray falls in between. It doesn't have anywhere near the rapid absorption. It doesn't have anywhere near the same success rate in terms of headache relief and pain-free and ultimately sustained pain-free. And what patients have told us they want is sustained pain-free. In fact, the simple way of looking at that is one and done. They treated, the headache was gone, and they can count on it. If you look at the statistics for oral triptans, even the most consistent response with an oral triptan is about 70% of the time in someone who's a responder, meaning if you've got migraines and you're used to taking a particular triptan and it usually works, 30% of the time you may as well have taken a sugar pill. We don't see that with the injectable sumatriptan.
For what types of migraine patients does he prescribe Sumavel Dose Pro?
The place where I use it is, first of all, anyone who has early peak to maximum headache. In other words, their headaches build quickly, they need a medication that works as quickly as their headaches come on. Or they tend to awaken with headache established, or they've had failure of oral triptans on a significant fraction of their headache days where it could be a backup for their usual oral medication. Or if they have nausea and vomiting, having something that they can count on that gives 97% absorption, regardless of whether their stomach is at a standstill or in reverse gear, is important. The simple phrase that I look at is wake up, back up, or throw up. Those are the people that ought to have an injectable option as part of their treatment plan.
Asking patients the right questions helps Dr. Schim to determine who is a good candidate for Sumavel Dose Pro.
I see a lot of physicians and patients as well accepting mediocre results from their oral medicines because it was better than the over-the-counters that they were using. So the doctor may say, none of my patients really need an injectable, but that means they didn't ask the right questions. The questions that I ask are, when do your headaches come on? And if they have a significant number of their headaches that come on awakening or in the early morning hours, or they tend to awaken and then the headache builds and they're trying to get to work and, they don't really have 2 hours to get pain-free or pain-reduced, which is the measure of success with oral triptans, then this is a medicine that they probably should have available. Likewise, asking them, how quickly do your headaches build? The way I phrase it to the patient is, how long is it from first to worst? From the first bit of pain to it's at its full peak. And then next is, do you get queasy with your headaches? Do you lose your appetite? Patients don't have to be vomiting to have an important role for a non-oral delivery system.
How important is it to set proper expectations with patients?
Setting patient expectations is critical. When I'm educating a patient about Sumavel Dose Pro, I start off with trying to give them a sense of what would you say to a treatment that could make you pain-free in an hour and oftentimes pain-free in 30 minutes? And they say, wow, is there such a thing? Yeah, there's an injection. And then their eyes sometimes roll like, oh, I don't do shots. So you say, well, okay, so let me show you. This has got no needle, so you can expect that you don't have to deal with sharps. You don't have to deal with disposal issues. You can travel with it, get on a plane, and if you get a migraine while you're flying, you can still treat yourself in the restroom on the plane and not be worried about your checked baggage that has your injectable needle stat dose or your oral meds that aren't going to work because you're already queasy. Look, it's going to hurt a bit, but not compared to a migraine. So, establish an anchor. I think that's important as one is thinking about setting expectations. Number two is for them to understand the mechanics of it. So snapping the top off is a little harder than it is on the demonstrator. Pulling the lever down, it's going to almost feel like you're breaking something. Don't worry, you won't. Those sorts of things, so that when they actually try it for themselves, they have a reasonable knowledge of what's going to happen and they're not surprised in a way that turns them off. I let them know that there's going to be a little welt, that's not a skin reaction, but it's just the drug that hasn't gotten absorbed yet. There could be a drop of blood. It could even bruise a little bit, but that all of those are, from my point of view, nuisance side effects compared to this stuff works. It's going to make your headache go away, and you're likely to be pain-free in an hour or less. And when you cast things in that context, it's the very, very rare patient that doesn't go out not only willing to use it, but pretty enthusiastic about the idea.
Dr. Schim shares a dramatic Sumavel Dose Pro success story involving a recent patient.
First consultation with a lady who had been having a 20-day-long migraine. She had tried several days in a row of her usual triptan and then gave up on it because it just wasn't shutting it off, and she came in having used nothing for several days. She was in the middle of an acute migraine. I gave her a Sumavel Dose Pro injection. She winced when she got the shot, but in comparison to her headache, it was trivial, she told me. And about 5 minutes later, she said, the throbbing's going away. 5 minutes after that, she says, the pain's getting less. 10 minutes after that, she says, I don't have a headache anymore. This was nearly 3 weeks into a migraine, and there's no way in the world that a oral triptan different than she had been using was going to have that sort of success. So the correlation between the pharmacokinetics of rapid achievement of blood levels is that patients see rapid relief, rapid pain-free, a high probability of getting pain-free, much greater than with an oral medicine, even if they're resistant to triptans in the sense of they've tried triptans and they didn't work. So much so that when I tell a patient, look, I've got something for you to try, and they say, I've tried oral sumatriptan or this or that, and nothing works, I say, yeah, but you've never really tried the gold standard. And ultimately, injectable sumatriptan remains the gold standard.